Dr. Speaker, Dr. Vice Speaker, members of our board, delegates, guests, thank you all for being here tonight. And thank you for the work you do each and every day back home to advocate for our patients and physicians. Your work and the work of this House over the next several days, it's just more important than ever. And I am particularly grateful to stand before you as a veteran on the day that we celebrate and honor our nation's veterans. And so I'd like to give another special thank you to all of my fellow veterans in the audience tonight. In my first 6 months as president of our AMA, I've had the opportunity to speak to physicians, residents, medical students from all around the country. And I've heard from them how the extraordinary pressures of practicing medicine in this environment continue to mount, painting a pretty grim picture about the state of healthcare in our country. But I didn't have to travel far to hear about these challenges. I've seen them personally. On inauguration night, I told the story of a dear friend of mine, a medical school classmate, an emergency room physician in California who worked tirelessly on the front lines throughout COVID. 2 years ago, he took his own life. He was an energetic and loving soul, a brilliant, caring doctor who felt the weight of the pandemic on his shoulders. He struggled to get out from under it, and I knew he struggled, but I didn't know how to help him, and he didn't know how to ask for help. I'm still deeply troubled by his death, just as I am haunted knowing that there are thousands of patients in his community who can no longer receive his care. More recently, another exceptional physician, a woman who I personally recruited to lead the LGBTQ health clinic at Vanderbilt University Medical Center, abruptly quit the program, no longer able to cope with the political pressures, the distorted half-truths about the work she was doing. I watched her post pictures online, hugging her friends, her colleagues goodbye, as she packed up her family to move to another state to practice medicine unburdened by restrictive state laws. Sadly, she's not the first, the last, or the only physician I know who has made the difficult choice to leave a community they love because of legislative overreach, in order to practice medicine the way they know it should be practiced. And a few weeks ago, I walked into the physician lounge, the Medical College of Wisconsin in Milwaukee, where I'm an anesthesiologist, and there I saw an experienced colleague who I know well completely break down, so clearly exhausted and overwhelmed. This is the picture of our healthcare system in 2023, and it is not a happy one. Everyone in this room tonight has stories like these, perhaps a friend, a colleague, or something you have personally experienced. What physicians endure today is often hidden from patients, hidden from the lawmakers whose decisions heavily influence our work. Up on the screen, you'll see photos from a project called The Disposables, which was created by artist Jeremy Rosario to highlight stories of physicians who have died by suicide. This image on the screen is Dr. Scott Jolly, an emergency department physician in Utah who tragically took his own life during the pandemic. Crafted from disposable medical equipment and devices, this installation is a powerful reminder of those we have lost and the work we must do to prevent these tragedies from happening again. It is our job as physicians and as leaders in this profession to bring these stories to light, to lock arms with one another, and to speak with one powerful voice to those who need to hear us. Medicine is not just at a crossroads, it's at a crisis, and we demand action. I know the work of advocacy isn't easy, and it goes far beyond what most of us learned in medical school. But the truth is, nobody's going to do this difficult work for us. It has to be us. Speaking truth to power has to be us. Pushing lawmakers to act has to be us. Fighting in court to protect patients from regressive and discriminatory new laws, from unsafe scope of practice expansions, has to be us. Demanding reforms to a Medicare payment system that penalizes doctors has to be us. You're going to hear a lot about Medicare payment reform at this interim meeting because of the high stakes involved and because of the damaging cuts physicians have had to cope with over the last 20 years. We are using this occasion sitting here in the shadow of the U.S. Capitol to highlight our grassroots Fix Medicare Now campaign. We have a Fix Medicare Now booth for you to get engaged with on this issue, and we are hosting an expert panel discussion on this topic on Sunday. I hope you can all attend. Physicians aren't the only ones who have to contend with a broken healthcare system. Our patients are suffering too. My parents live in Jacksonville, Florida. They're in their 70s, and like many of their age, they have a number of age-related ailments, chronic diseases, and some mobility limitations. They require complex care and need to see a number of specialists. They rely on a trusted and longtime primary care physician to coordinate their care. That was working fine until their primary care physician stopped seeing Medicare patients. And we're all familiar with the reasons why physicians stop seeing Medicare patients. They typically come down to one thing: inadequate payment. An inadequate reimbursement rate that, if you're in private practice, makes it tougher and tougher to keep the lights on. Too many seniors, like my parents, have gotten the same letters notifying them that their doctor was no longer able to see Medicare patients. This usually leads to a frustrating and frantic search for a replacement, and too often causes harm. As delays occur, things get missed, patients often have to travel farther to receive necessary services. And sadly, this is playing out all over America. More than 100 million Americans do not have regular access to a primary care physician, a number that has nearly doubled over the last decade. Many of you may face similar situations in your own families, in your own practices, or you've watched a colleague's practice pushed to financial ruin because of our failed Medicare reimbursement system. The chart up on the screen tells the story. Adjusted for inflation, physician payment under Medicare has dropped 26% since 2001, my first year of medical school, far greater than the rates at inpatient or outpatient hospitals or at nursing facilities, with more cuts planned next year. Meanwhile, we've all experienced high inflation, rising personnel costs, and increased practice costs that exacerbate these cuts. So here's what we're going to do. Tonight, we're going to send a message to Congress right now and tell them enough is enough. I want everyone to take out your phone, take a picture of that QR code. It's going to take you directly to the Fix Medicare Now website, where you can scroll to the bottom and take action now. It takes 2 seconds. You can send an email directly to your representative in Congress and tell them to stop the Medicare cuts planned for 2024. I see people getting their phones out. I think Ethan has done it over there. My mother-in-law is doing it. You can all do it too. Thank you. So, in addition to stopping the cuts planned for 2024, We're also pushing Congress to pass the Strengthening Medicare for Patients and Providers Act, a bipartisan bill in the House that would do what the AMA has long advocated for: link Medicare physician payment to the Medicare Economic Index, finally putting us on equal fiscal footing with every other provider in the Medicare system. You know, I don't know many businesses in any industry that could withstand a 26% drop in revenue and still survive, much less an industry like ours that is so essential to the health, vitality, and economic well-being of our nation. Fixing our unsustainable Medicare reimbursement system is illustrative of why we created our recovery plan for America's physicians in the first place, and why it remains the focus of our state and federal advocacy efforts. When a system becomes so broken that year after year it places greater financial pressure on physicians, in fact penalizing them for providing care to Medicare patients, we cannot simply shrug our shoulders and ignore it. The cuts are too deep, too relentless, and they touch too many lives, physicians and patients alike. We must keep the pressure on, and we will. All right, put your phones away now. So by now, I know you're all familiar with the pillars of our AMA recovery plan, but I can tell you this plan has really struck a chord with physicians because we speak to the universal frustrations that we all share: reforming Medicare, stopping scope expansions that threaten patient safety, expanding telehealth opportunities, fixing the onerous prior authorization process, removing the stigma around physician burnout, and prioritizing good mental health. These are not just words on paper. The AMA is making real progress on each of these pillars. AMA advocacy this year helped bring about a new CMS regulation that right-sizes prior authorization and Medicare Advantage plans by ensuring continuity of care, by improving clinical validity of coverage criteria, by increasing transparency of healthcare plans processes, and reducing care disruptions. And we're working closely with state and specialty societies to provide legislative language, talking points, data, other resources to push for important reforms in legislatures across the US. Here, too, we're making an impact. About a dozen states have now adopted comprehensive prior authorization reforms, many based on our model bill. And there have been more than 30 reform bills introduced in states in this legislative session alone. We're seeing momentum for reform build in the private sector as well. Cigna and United Healthcare, two of our nation's largest insurers, have announced their own voluntary reform efforts to reduce prior authorization hassles. It does remain to be seen how significant this change will be, but this is a huge victory for physicians and patients who have long been frustrated by prior authorization demands. Insurers know the pressure is on, policymakers know the pressure is on. The progress may not be as fast as we all want, but it is happening, and we can feel good about that. The AMA also continues to fight inappropriate scope of practice expansions by non-physicians wherever they flare up. In September, I had the honor of testifying in front of a House subcommittee hearing on Veteran Affairs to represent the AMA and discuss how scope of practice expansions can threaten the quality of care that veterans, my shipmates, and I receive. And at that hearing, I sat next to an optometrist who, on the record, referred to himself as a physician. It was an outrageous reminder of why we need to continue to push back against these expansions and why we need to lift up physicians as leaders of healthcare teams. Our efforts are making a difference. AMA Advocacy, in coordination with our Federation partners, has achieved more than 85 state-level scope wins so far in 2023. We have much to be proud of in this work, but we know the bills will keep coming. We cannot afford to lose our focus or our resolve. And finally, in our comprehensive strategy to reduce physician burnout, we continue to honor and celebrate employers and practices that are doing right by physicians and the patients we serve. Just last month, the AMA recognized 72 health systems, hospitals, and medical groups as a part of our annual Joy in Medicine program. It evaluates employers on their leadership, teamwork, practice efficiency, other criteria to develop a roadmap for reducing burnout that others can follow. Created just 4 years ago, our Joy in Medicine program has become a national model by which our nation's best hospitals and health systems should be judged, because it not only recognizes exemplary practices, but it takes that next crucial step by providing clear and evidence-based practices to help others understand where they can succeed and where they fall short. This is the most effective way to elevate health system performance and accountability by targeting the systemic drivers of burnout. Now, on all these issues, I continue to be guided by a sense of optimism, a sense of purpose, because I see the real progress that we have made. I see the capacity of everyone in this room to force change that makes a real difference in the lives of patients and physicians. There is no doubt that this is hard work, but our voices, our stories, and our experiences are powerful, and we must amplify them to shine a light on what is truly happening in our healthcare system. It has to be us. It has to be us because we experience the realities of a broken healthcare system each and every day. It has to be us because we know the care our patients deserve and how to best deliver it. It has to be us because despite ongoing efforts to undermine faith in science and medical institutions, people still trust and believe in their physicians. And finally, it has to be us because we will always put science and the ethics of our profession first. Thank you very much.